Hey everybody, it's Melissa, the RN.
Hi, I'm Robin, the esthetician.
We're going to be doing microdermabrasion, so let us know if you have any questions.
So microdermabrasion there are two different kinds. The kind that I use uses aluminum oxide crystals that come from this machine. They come through this hose and out through this handpiece. So what we're going to do is go along Melissa's skin here. We're going to do a vertical pattern, and then we're going to come back and do a crosshatch horizontal pattern. So we're just going to go ahead and start. And for lack of a better kind of a comparison, microdermabrasion is like sandblasting. The crystal particles come out of this handpiece at a really high rate of speed. It feels a little bit scratchy. Does it hurt, Melissa?
Not at all.
Okay. So it feels a little bit scratchy. And what we're doing is breaking down these cell walls on this dead skin, the outer layer of the dead skin. So we're going to come back this way. And I'm not sure if you can see there's little particles on her skin, but it really helps to smooth out texture. It really helps to brighten your skin up. If you do a nice series of these every few weeks or once a month, you can tell a big difference. Your products wear better, work better, you're able to absorb better. Your makeup wears better, is smoother. So as you can see, we're just going along here. It helps to break up some, and Melissa doesn't have a lot of sun damage, but it helps to break up some of this spotty pigment. And just for, you can get pretty close to the eyes there, around the crow's feet. She's a little bit pink, but that's normal. And just to give you another quick idea of how this is finished off, I'm going to change my machine and put it into just vacuum mode. Turn it up. And so what we're going to do now is, this machine now is all suction. So we're going to come back along where we were. The machine uses a little bit of suction when you're doing the initial pass with the crystals, but there's still some crystal particles left over on the skin. So we're going back and we're kind of sucking up these crystal particles and dead skin particles. The other good thing about the vacuum is that it stimulates your dermis and increases your circulation and the blood flow from your dermis, which in turn helps to oxygenate your tissues. So that little bit of vacuum does a lot of different little things. So we would just go ahead and vacuum all of this off. And we would do the rest of her face, around her neck, chin, upper lip, nose, and the other side of her cheek, the other side of her face. And I'm just getting all these little particles off of here. This is good for pretty much any skin type. You would want to stay off any retinols, Retin-A, for about a week prior to having this done. If you've ever used Accutane, you definitely want to be off Accutane for about 6 months. So it works for pigmentation, it works for larger pores, it works for fine lines and just overall texture issues. So we're going to go ahead and finish Melissa up. Thanks for tuning in. See ya.